Now let's queer up health. Elder Pride Act by Congressional Equality Caucus to support LGBTQ+ seniors. 3 members of the Congressional Equality Caucus introduced the Elder Pride Act, a new piece of legislation aimed at improving resources for older LGBTQ+ Americans living in rural areas. Representatives Mark Pocan, Sharice Davids, and Suzanne Bonamici, who chairs the caucus's LGBTQI+ Aging Issues Task Force, spearheaded the initiative to address significant gaps in services for the vulnerable population. The Elder Pride Act proposes updates to the Older Americans Act to better support LGBTQ+ seniors, especially those living with HIV. Key provisions of the bill include establishing a rural grant program to fund cultural competency training for service providers, enhancing connections between LGBTQ+ older adults and local services, expanding non-discrimination policies, and providing resources on sexual health and aging. This initiative aims to tackle barriers such as geography, cost, insufficient broadband infrastructure, a lack of specialized providers, and stigma. The bill also has the support of Representative Ayanna Pressley, who criticized Republicans last fall for removing funding for an LGBTQ+ elder housing project in Boston. Conversely, Representative Andy Harris of the far-right Freedom Caucus opposed the project, claiming it discriminated against straight people. Well, I'm happy that finally Bonnie will get the care that she deserves. And that I work on a few days a month at an elder care facility, working with Alzheimer's patients and with kind of a retired elderly community. And I see them every day. It's been years that I've been doing this now, and I've had a different appreciation for the elder community. We're all going to get there if we're lucky.
Right.
If we're lucky, we're going to get there, and we all are going to need these services. And our LGBTQ+ community in particular is kind of unique in that we have a much larger percentage of us being single and not having children. And so when you don't have these people to either visit you or to take care of you, we have to stand with each other. And I have this pact with all my single friends. It's like, on every holiday, like we have to text each other. We have our group thing because we know we ain't got no partners. We had nobody take us to the airport.
That's true.
Like, it's our...
You are very alone, yes.
Exactly, and so thank you for reminding me.
I just wanted to make it very clear.
Yeah,
That's right.
So
Daddy is alone, guys.
Yeah, it's really important that we have these services built into our infrastructure. So, and it's not just for the LGBTQ+ community, it's for all the people who fall into that community of people who just don't have the support system. So it's important. My Caribbean parents, that was like such a huge thing, and it's different maybe in America, is that taking care of your family and your grandparents and your great-grandparents, whoever, is like of the utmost importance and respect. It's just something that's a little bit lacking in this country, and I'm glad to see maybe a little change on that front.
They say by 2030, half of the country's population will be over 50.
Right.
Ooh, hot.
So that, that's half of us at this table, right?
1, 2, 3,
4.
I'm always,
But anyway,
I'm already over 50. So.
But then you talk about, it talks about LGBTQ+ and the HIV population.
Right.
And you think of that and, people living with HIV are living much longer. It's not a death sentence. They aren't dying at the average age of 32. They're living, in most cases, longer than the average man that would, say, live that doesn't have HIV. Why? Because they're in healthcare.
Right.
And I think this act is actually going to be knocking down barriers that are going to allow these people access in these communities that don't have access to clinics or don't have access to medication. And I think it's just going to continue to prove that because everybody in the country is aging and we've got to be able to take care of everyone.
My incredibly sexy husband, Ray, has worked in post-acute care, senior living, rehab facilities for his entire career. And having that in my world and hearing him talk about it, it's not necessarily a crisis, but they are very much aware of the fact that an entire generation of LGBTQ people, because of the AIDS epidemic, was knocked out, and so now we have this aging populace within our community. And what do? We don't want to send people back into the closet, basically into, senior living facilities that aren't accepting and blah, blah, blah. So it's a new world in that entire landscape.
Yeah. And, part of the thing that makes this really important is they're focusing on rural areas. And we live in, cities that have LGBT organizations and events and clubs, and in these rural areas, they don't have anything. They might not know more than maybe a handful of other LGBT people. They may live their lives without that kind of a community. And what's really dangerous, in addition to, HIV/AIDS, but just healthcare in general. And seniors, LGBT seniors, one of the main reasons that LGBT seniors don't seek medical care is because they're afraid of how they're going to be treated. And if you're going to a doctor, you really need to be honest with your doctor. And if being honest with your doctor means they're going to judge you, then they don't want to go to the doctor.
That's true.
So, focusing on these rural areas to make sure the safety net is there for these folks, it's so important, because we do it here in the cities. We got it covered, but those folks out in the far-reaching areas, it's very tough for them.
Yeah.
So
a lot of the elder queers went through a lot in the 90s, 80s, 70s, 60s, early 2000s, mid 2000s, today. So I appreciate this being brought to the table for them to really show we haven't forgotten about you. You're still cared about. You're still a human being. You went through some actual traumatizing events in your upbringing, just being yourself. And because you endured that, we can also be ourselves. So It's not really a thank you, but from me, I didn't do it. But it's a huge thank you. So thank you so much for all of you. This is no joke. You are older than me. Thank you so much for all your contributions that allow me to sit here and be the sexiest one at this table.